And our second speaker is Ms. Tara Chen. She's the project manager for our EDA Family Medicine and Community Medicine Department. She will share the EDA Hospital's COVID-19 strategy with the public health dimension. Now I hand over the floor to Ms. Tara Chen.
Thank you, James. Just give me 1 moment. We're getting the PowerPoint set up.
And also, if any of you have any questions, please share your questions or thoughts through the chat box, and at the end, we'll try to address as many of them as possible. Thank you.
I know we're a little tight on time, so I'm going to do my best to be brief. I'm not a physician, but I come from a public health background. So as James mentioned earlier, our current situation, we have 443 cases, 7 deaths, and around 428 have already recovered. But I think what's really important to mention is that majority of our cases are imported infections, meaning they were overseas Taiwanese citizens who came back to Taiwan or they were evacuated. So it's been well over a month since we've had any kind of locally transmitted infections. And as James mentioned, so EDA Healthcare Group, we have 3 different hospitals. So there's EDA Hospital, EDA Cancer Hospital, and EDA Datang Hospital. And all 3 of them have different focuses, but EDA Hospital is the big hospital that focuses on acute and critical care, and they are the response hospital, which means that in Taiwan, if there are cases, confirmed cases of COVID-19 patients, EDA Hospital will be the one that receives them. And all 3 of them have JCT accreditation, and EDA Hospital is also JCI accreditation. So they really focus on patient-centered care. So it's really important to also understand that in Taiwan, they had the SARS experience back in 2003. When in Taipei Municipal Haiping Hospital, there was a physician who came in contact with a patient with unknown pneumonia. And from there, we've seen 150 acquired infections, and then it led to 35 deaths, which included 7 healthcare staff. That case study was actually very important because it was the first time one of the hospitals was closed. It was under lockdown because of the hospital-acquired infections. And our physicians here, everyone was around in that SARS experience. And because of SARS, a lot of faith was lost in the medical system. And so when we saw the outbreak for COVID-19, everyone knew that they wanted to make sure that we are transparent, we're communicative, and we have a rapid response to prevent SARS experience from happening again. So because of SARS, the Communicable Disease Act in Taiwan was revamped. And that led to, as you know, you can't have a response without policy. And by having these policies put in place early on, we can have a rapid response in Taiwan. So what EDA did is they followed the Center of Disease Communicable Center. And they are the ones who lead the national response in Taiwan. And they share their new plans and strategies and policies every day to the healthcare services and frontline workers in Taiwan. And so based off that, EDA created their contingency plans. So every year they have tabletop exercises and drill simulations focused on epidemic control, infectious outbreaks, and they're also audited, meaning that they have to revamp their system and they have to keep their measures up so it's at a high level, regardless of any time they know how to act if there is an outbreak. And so you can see that it's very comprehensive. It includes from everything from disease surveillance control to training, manpower deployment, even corpse disposal and patient transport process. By having these plans in place ahead of time, when we come into the situations such as COVID-19, we are prepared early on. So this is EDA's timeline with COVID-19. This is only until May 12th. And so our first case, when we saw December 31st, when China started reporting the outbreak in WHO, the Taiwan CDC, they started the health checks to flights from Wuhan. And at EDA Hospital, by January 1st, they were already setting up a basic fever and TOCC station and triaging in the ER because everybody was on high alert of what was happening. You can see from January, there was a lot of different policies put in place, and that's because no one knew exactly what's happening on a global scale. And there was a lot of different policies being implemented from Taiwan CDC. So EDA Hospital was doing their best and keeping up with the pace to make sure that all of their epidemic measures and prevention was following the national guidelines. So we've seen everything from, we've had the establishment of an incident command team, and that has daily meetings every day to make sure that we talk about what are the changes happening on the national level, what kind of things need to happen in the hospital. There was already training being provided for the workers. Employees were being asked to avoid certain epidemic areas. And then February 7th, the NHI card system began, and I'll talk about that later on. On February 12th, we've had established an outdoor outpatient clinic. So these were for high-risk patients, because at that time, there was travel alerts for travelers coming back from China, Macau, high-risk areas, and they still need to see a medical doctor. So we would have an outdoor outpatient clinic, so they wouldn't actually come into the hospital, preventing hospital-acquired infections. We've had gatherings for over 50 people banned. We reduced elective surgeries where possible, and also ensure that within our organization, we can provide safe guidelines such as social distancing in our food court. And we also focus a lot on staff. We have a high-risk care team who are in charge of these patients, and we want to make sure that their mental health and they have a safe area to rest where needed. Around March, we had more travelers coming back at that time, if you've seen Taiwan's trends for outbreaks. So around that time, we actually suspended all visits for nursing homes, and we restricted a lot of visitors to the hospital to prevent unnecessary visits. But you can see from April to May, what's really interesting is this is when we started actually easing our restrictions. Like I said, we haven't had a locally transmitted infection for well over a month. So we're beginning to ease our public access control. So EDA was also very, very quickly providing a rapid response to this. As I mentioned, they did have an incident command team meeting set in place, and they have meetings every single day. And they work with the CCC, which is Taiwan's headquarters for the COVID-19 response, following their recommendations that are always changing to prevent these hospital-acquired infections. What we did also is we rerouted the public entry to two main entrances, which is the main lobby and emergency room. By rerouting the public entry, you can really control who's coming in, and you can keep track if there's any kind of patient with suspected symptoms. And we also disperse the staff workplace to make sure that we don't have a horde of staff members close together. If someone gets sick, then it would create a cluster of hospital-acquired infections, and we would have a reduction in hospital workforce capacity, which we know is not a good sign during an epidemic. So what I was talking about with the NHI card is that you have to understand that Taiwan's health system is very digital. Every single person has a national health insurance card, and even foreigners who have only been here for over 6 months, you can also get this card. And this card is really important because inside this digital chip, all you do is you can go to any hospital, any clinic, and it has all your information on it. The doctor just puts it in, they have access to your records, and it's very, very simple. So what they did was they linked it with the National Immigration Agency. And so the National Immigration Agency is in charge of the travelers coming from abroad who left the country or came into the country. By doing this, we can check at the hospital at the front doors to see where you've been, check the TOCC to see if there's any kind of travel history that we should be aware of. And we were also linking it with a mask rationing supply chain, as we know that PPE is a global shortage right now. Taiwan early on stopped exports of the mask and rationed for each citizen allocated amount. Right now it's 9 per every 2 weeks. And to make sure that we had enough PPE for the healthcare workers, the public would just have to use their healthcare card to purchase their mask ration for the week. So to enter the hospital, there was 4 steps. You had to put on a mask, use hand sanitizer, check your TOCC, and get a stamp. If you had 1 stamp, it meant that you had no symptoms, but you went through this process. It's really important because this way we can keep track if there was anything out of the ordinary. If you had 2 stamps, it meant that you actually, there was a sign that you traveled somewhere, or you maybe had a fever. So this way, when you get to the physician, the patient talking to the physician knows ahead of time that this person traveled or this person has a sign or symptom that we need to be aware of. And you get your body temperature check. And so this is kind of what it looks like when you insert the card. This would kind of pop up. So this is an example for someone who actually did not finish their quarantine, and it's very bolded in red that this person should have not even been out in the public. So when we check this at the front door, we can quickly call the local health bureau, which is a local hotline in charge of all of our cases, and we can send the person outside, make sure that they don't enter the hospital, and take the necessary cautions to make sure that we are self-quarantining and protecting our employees. So there is also a gradual implementation of epidemic measures around the hospital. As I mentioned, we restricted the food court. It was 1 seating per table, and we also focused on takeaway. We removed, we put a sign in the middle seats of the waiting rooms to allow social distancing. For pharmacies, they had plexiglass in between to prevent the spread of airborne germs when they're talking about their prescription. And we also had social distancing labels for any time if they had to line up to get their medicine. We've also made sure to increase the frequency and replenish for hand sanitizer. For the pharmacy to also, what we did was we focused on an outdoor kind of style drive-through pickup where a patient could meet outside the hospital. The pharmacy would come out, check their NHI card to make sure it's the right medication, but then this way it prevents the patient or the member of the public ever from entering the hospital. So it reduces hospital visits inside where necessary. And we had the outdoor area for inspection of suspected cases, and all of our meetings for over 30 people were shifted to conference calls where we can. So what's also really key is that from an organizational standpoint, you have to also have a centralized communication. The response is really focused on a collaboration with departments. We have our physicians, but we also have our administrative staff. And what's different in Taiwan is that when we were checking the TOCC at the front door, it's actually administrative staff who are scheduled to be at the front. And by doing that, you have to make sure that you're working around everyone's schedule. And one of the reasons they did that was so that we can dedicate and protect our physicians, having them only contact with the confirmed cases, and then we have administrative staff checking for the front screening. And this is a really good way to make sure that we're using our workforce to the full capacity. So the hospital policy in Taiwan is also, we are not allowed to disclose if we had any confirmed cases without authorization from the Taiwan CDC. And that's because they believe here that would create panic, because a lot of members in the public, they go hospital shopping here. Hospitals, they don't have a gatekeeper system. So hospitals are where they come to get their clinics, their prescriptions. So it's really important that we're not creating chaos in the public as well. And so every day, the incident command meetings, they would always provide updates. There was an allocated area on the website for the staff to know what's going on, what kind of new research was coming out. There was a line group for the leadership team, and they also made sure to create visuals for the public that was very health literate, which I think is very important, because if you don't have a basic understanding of the information given to you, it's very difficult for members of the public to not feel panic. They might see things online and we've seen how much of an infodemic there is right now. And so it's really important from our organizational standpoint is to focus on the staff. So they really wanted to build resilience because this epidemic is a very long-term situation. And so for the high risk care team, sometimes you can be a bit worried if you go home, you might have had a contact with a patient, you're not sure. And to provide that safe space for them to not feel that they're going home and potentially infecting their own family members, they made sure to allocate rooms in the hospital dormitories to make sure that they have a place to go to and also a place to rest. They also focus a lot on mental health support, open communication, transparency. And I think it's really great that they've been using creative avenues to get their concerns or also find a way to be motivated every day. So here we have someone who made a TikTok video, which I think you've all heard of. It's a very popular kind of social media avenue on how to wash hands. And it went very viral in Taiwan. And they've also done art walls, which is spreading epidemic measures in a very kind of creative way, allowing them to use art and their creativity to channel their concerns. And so even though Taiwan, it has been successful in terms of the low amount of cases we've had, our health sector is still impacted because there is still an economic impact. Regardless of what we can do, there's always going to be that anxiety and fear from the public because this is a very unknown situation. So there was an avoidance of hospitals and health clinics. We had a decrease in hospitalizations, the number of visits. And so you can see here, this is 2019, this is overall Taiwan. So where hospitalization, we had 260,000, but by 2020, there was a change of 14% decrease. And then for outpatient, we also had a 17% decrease, and emergency room, 15% decrease. So we do notice that there is an economic impact, and this is something that I think everyone is taking cautious of right now because, it's not just figuring out how to bend the curve, but it's also how do you focus on the aftermath of COVID-19. So what we're also really happy to see, though, is that there is a gradual release of measures currently. We are opening up visitor restrictions. Like I said, we did have a ban for all visitors coming to the nursing home, but it's opened up again. And our TOCC, it is reduced. This changes for every hospital, but for our hospital, instead of going through that 4-step process, we do have our administrative front screening staff still on high alert. But all you do is you have to wear your mask, you still get the hand sanitizer, but we don't check your TOCC anymore because the reason for that is that we've had very limited imported cases as well. There's a lot less traveling and everyone is getting caught right at the airport. So to check their travel every time, it was becoming unnecessary for where we are now in Taiwan. And as of June 1st, our public mask exports and our supply has been opened up, so it means that Taiwan has done a very good job with containing their PPE supply. So it means that we can start, relaxing a bit where we are with our measures. And so, as we know, I think this is just, it's not a one-size-fits-all approach. There is a lot of things to take in consideration. What works in Taiwan may not work in Bangladesh, but I think it's important to share these kind of collaborations. And our focus is really just to see where we can help everyone and move forward from here. And if you want to learn more about our situation in Taiwan, if you go on YouTube, you can search Ida Healthcare Group, and there's a longer presentation for this. Thank you very much.